discuss about respiratory system of Pigeon. I'm Dr. A.D.M.COLLEGE, Assistant Professor, PG and Research, Department of Zoology, A.D.M. College for Women, Autonomous, Nagapattinam. Okay, what is respiratory system in birds? The respiratory system of pigeon, like that the other birds, is uniquely adapted to meet the high oxygen demand required for sustained flight. In addition to facilitating gas exchange, the respiratory system also helps birds regulate body temperature and maintain proper pH balance in the blood. And respiratory tract. The respiratory tract include nasal sac, glottis, larynx, trachea, and syrinx. What is nares? Nares, the birds have an external nares which are slight like opening located at the base of the upper beak and covered by a sensitive skin called that is a cirri. The external nares leads to short nasal sac that they are connected to the padding through the internal nares. And birds have a median slight like glottis located behind the base of the tongue that open into the trachea, which is the tube connecting the lungs with the outside at the front end of the trachea. There is an enlarged chamber called as a larynx, which is producing sounds for communication. Larynx in birds is a voiceless chamber that is located at the front end of the trachea and is much smaller than in mammals. It is supported by a triangular crocodile cartilage, and there are no vocal cords like those found in mammals. Instead, the larynx of birds function as a passage for air into the trachea. The larynx open into the long trachea which leads to the lungs. And trachea. Trachea is a long and flexible tube that runs down the neck of birds. It is located beneath the esophagus and is slightly displayed to the left by the crop in the thoracic cavity. The trachea expanded into a specialized organ called syrinx and then divided into two bronchi, each leading to the lungs. The walls of both the trachea and bronchi tubes are supported by rings, that is a tracheal, which are first bronchi rings being completely bony and encircling tube, with the bronchi rings are partially cartilaginous or incomplete on the inner side. And next one is syrinx. This slide slowly explain the syrinx is a unique vocal organ that is found only in birds, and it is located at the junction of the trachea and third bronchi. It is an expanded chamber called the tympanum, and its wall is supported by the last 3 or 4 tracheal rings, that is the first half rings of the 2 bronchi. The inner mucous membrane of the syrinx form a cushion-like thickening on each side on a pair of cartilages called as the pleural extend between the bronchi to supported to fold of mucus, and mucous membrane is called as a membranous semillunaris, and mucous membrane of the inner wall of each branchiae from the internal and external tympaniform membrane that is associated with the outer wall. And the syrinx is a vocal organ in birds. It is responsible for producing some sounds. It is controlled by intrinsic syrinx mucus that arises from the side of the trachea and instead into the syrinx, as well as sternotracheal muscles that arises from the sternum and expanded from the lungs and passes between the semilunar membrane, causing them into a vibrate. The pitch of the sounds can be altered by the tension on the membrane, which is controlled by the intrinsic of sternotracheal muscles. However, it is the syrinx is absent in some birds, and it is such as ostrich and storks. And this image clearly showed the respiratory system of pigeon lungs and respiratory organs. It is the mainly respiratory organ in lungs. The pigeons are highly vascular, compact or solid organ that are located in the pleural cavity. Unlike other vertebrates, they do not store air. The dorsal surface of the lungs is in the close contact with the ribs and thoracic vertebrate and located peritoneal covering, and the ventral surface is covered by a specialized fibrous peritoneal membrane called pleura or pulmonary opener neurosis, as a small fan-like muscles called a costomuscular muscles are attached to it. And the bronchus entering the lungs of birds is called a primary bronchus, and it does not branch immediately like in other animals. It continues as isobronchus and gives off a bronchus of air sacs as well as several secondary bronchi, which further branches into tertiary bronchi or primary bronchi. The bronchi from an intricate network of thin walled air capillary that form loops or join recurrent bronchi. And the lungs structure in birds is different from that in mammals, as the bird's lungs lack alveoli and instead have a intercommunicating system of bronchi and parabronchi and air capillaries that form complete air circuits without any dead space, allowing for efficient gas exchange between the air and blood in the vascular respiratory membrane. And air sacs in birds, some secondary bronchi divided into parabronchi, while other pass through the lungs wall and enter the air sacs, which are large thin walled structure. They do not increase in respiratory surface and fill much of the body cavity. These air sacs are dilations of bronchi and have opening called ostia. Then they have further air sacs that are connected to the lungs through recurrent bronchi, which recurrent pure air to the lungs region have 9 large air sacs named as on the position of the body. So, and the interclavicular air sacs are fused during a development. And interclavicular, what is interclavicular? It is a air sacs in a triangular air sacs located between the ankle of the two limbs of furcula and gives arises to two auricular air sacs, the axillary and clavicular air sacs, and cervical. It is a two small cervical air sacs emerged from the anterior side of the each lungs located at the base of the neck and running parallel to the vertebral column and dorsal and interclavicular air sac. These are air sacs also release minor sacral branches in the neck, and anterior thoracic air sacs are arises from the side of each lungs, and it is located at the ventral side of the lungs. It is anterior part of the thoracic in close primary to the ribs and pericardium. It extend back and overlap the posterior thoracic air sac. It is ventral wall remaining covered by the oblique septum and posterior thoracic. It is a small posterior thoracic air sac is located in the posterior part of the thoracic cavity just in front of the abdominal sac. Each sac overlaps the posterior end of its corresponding lungs and communication with its outer posterior ankle. Abdominal region. In each lungs has a large abdominal air sac that arises from its distal end. The sacs are situated along the dorsal wall of the abdomen, ventral to the kidney, and among the coils of the small intestine. And functions of air sacs. These air sacs are thin air reservoir that they are connected to the bone branchiae of the pneumatic cavity of the bone. So they are following functions. First one is accessory respiratory organ. The air sacs are not primary respiratory organ, but they assist in respiration and functioning as a below that force air into the lungs during expiration, ensuring complete renewal of air. This results no accumulation of unrespiratory air in the lungs. Hence, there is no dead space. However, study suggests that the anterior air sacs, interclavicular, cervicular, and anterior thoracic, they are more active during flight and act as a expiratory, while the posterior air sac, it is a thoracic and abdominal and more active during rest and act as the inspiratory. And lightness. The idea that our sac give the birds during a flight by reducing their specific gravity will contain warm air in no longer supported. So, temperature regulation. The air sacs also assist in regulation of body temperature by acting as a cooling system. They achieve this by losing body heat through inter-evaporation, where water vapor diffuses from the blood into the air sacs cavity and passes out through the lungs, resulting in heat losses, burst temperature. Then cardiac movement. It is Muller 1908 suggests that the air sacs facilities are moved in a highly inflexible thorax and flight. It is a high developed air sacs founded in the Thus, flying birds confirm their association with flight. And respiratory mechanism, how to work in respiration in birds. The process of expression in birds such as a pigeon is active rather than inspiration as a other vertebrate. In addition, the lungs of birds have a large internal respiratory surface. Breathing a rest when during a inspiration in a resting pigeon, the costopulmonary or intercostal muscles lower the sternum, causing the air sacs to expand and the lungs to be compressed, so thereby increasing the thoracic and abdominal cavity and reducing the pressure on the lungs. So air is drawn into the posterior air sacs through the mesobronchus, while is present in the lungs, entering into the anterior air sacs. This results in a large amount of air moving from the into the air sacs during respiration. And during expression, the abdominal muscles contract and arises from sternum, compressing the air sacs and causing the lungs to expand. The compression of the posterior air sacs forces their air into the lungs through the recurrent bronchi, while the air entire the anterior air sacs flow into the mesobronchus, trachea, and out through the nostrils, throughout the nostrils. Breathing during a flight, during flight, the sternum and ribs become immovable to brace the wings, and the ordinary method to inspiration and expression by intercostal and abdominal muscles respectively is abundant, and instead the air movement in and out of the lungs are elevation and depression of the back with the help of the wing stroke. The birds fly faster, and the rate of air circulation and gases exiting their lungs increases. So the intercommunicating system of tubules allow for constant renewal of air, which passes several times over the respiratory epithelium of air capillary. This complete aeration of blood results in high muscular efficiency and helps maintain a body temperature ranges from 1 or 2 degree Fahrenheit. The pigeon, in overall, the pigeon respiratory system consists of a series of interconnected air sacs and lungs that work together to efficiently transport oxygen to the bird cells and remove carbon dioxide. Unlike mammals who rely on a single set of lungs, birds have a system of air sacs that extend throughout their bodies, allowing for a continuous flow of fresh air. So, when a pigeon inhales, air enters through the nostrils and travel down the trachea, which divide into 2 bronchi that leads to the bird's lungs. From there, air is drawn into a series of air sacs located throughout the bird's body as the pigeon exhales. The air pushes out the lungs and into a separate set of posterior air sacs. So, during a subsequent inhalation, so the air is drawn from the posterior sac into the lungs, while fresh air is drawn into the anterior air sacs. So this constant flow of air allows for efficient gas exchange and helps keep the bird's respiratory system functioning optimally. So, in conclusion, overall the pigeon respiratory system is facilitating examples of the remarkable adaptation that birds have developed to meet the demands of flight by using a system of interconnect air sacs and lungs. So pigeons are able to efficient extract oxygen from the air and maintain a high level of endurance, in the sky. Thank you.